Hello everyone, I am Dr. Anuprabha Karthik, Consultant Obstetric and Gynecology and a Fertility Consultant from BabyScience IVF Center, Kalyanagar, Bangalore. Today we are going to discuss about an important topic, do's and don'ts after your embryo transfer. As we all know, embryo transfer is the final step in the IVF process. The success of the IVF depends on the quality of the embryos and the ability of your embryos to implant in the uterus and also the endometrial receptivity. So once the embryo transfer is done, we have a 2 weeks wait period to know whether your pregnancy is successful or not. So patients are really anxious to know what they have to do in this 2 weeks wait period and how they can improve their chances of pregnancy. So let us discuss in detail about the chances of improving a successful outcome. We'll start from the day of the embryo transfer. On the embryo transfer day, report to the center at least 2 to 3 hours before the scheduled embryo transfer time. If you are coming early, the anxiousness of the procedure will be relieved, and a patient will be asked to drink water on the day of embryo transfer so that your bladder should be filled to do the procedure. So the purpose of asking you to drink water is so that we can visualize your uterus, and under ultrasound guidance your embryos will be placed safely through a catheter into the uterine cavity. So once embryo transfer is done, you'll be advised to lie down in the same couch for 10 to 15 minutes. After 10 to 15 minutes, we'll be asking you to empty the bladder. But some patients will not be able to control the bladder immediately after the embryo transfer, so they wanted to pass the urine immediately. In that case as well, there is no problem. Your pregnancy rate will not get decreased. And even some patients are asking me that if I stand immediately after the embryo transfer, will my embryos will fall down? That's actually a myth. So uterus itself is a closed cavity, so chances of falling embryos will not happen, because we are creating a space and placing your embryos into the uterus, and once we place the embryos inside the uterine cavity, it will be deeply embedded into the endometrial cavity. So there's no chance of falling down of your embryos even after you get up after the embryo transfer. So once this is done, you can rest in our center for 3 to 4 hours after the embryo transfer procedure. After this, patient wants to know what mode of transport they have to take for a safe travel to their home. See, any mode of travel will not be going to affect your embryo transfer result, but better to travel by car, by avoid little jolting can be avoided. Better to avoid traveling by bus, bike or auto, that can be avoided. Even your patients are little far away, you can even travel by train. There will not be any issue, and there will be no decrease in pregnancy rates as far as we have seen. And as once the patient are going to their home, the patient wants to know whether they can climb the stairs. It's a frequent question people ask us, whether they have to, even they are in the first floor, whether we have to rent a house and stay in the ground floor. It's not at all required. Even your house is in the first floor, you can climb the stair. Again, it will not affect your pregnancy chances. And they want to know how long they should take rest. Generally, we advise 24 to 48 hours of bed rest is recommended. After 48 hours, strict bed rest is not recommended. You can go for modified physical rest, where you can avoid only strenuous activity like gymming, jogging or running or walking fast. All that can be avoided, and even you can carry out some minor activities like walking, cooking can be done after 48 hours of bed rest time. And sexual activity should be avoided, because any sexual activity, again, it will induce the uterine contraction. In turn, it will reduce the implantation capacity of your embryos in the uterine cavity. Apart from that, during this 2 weeks time, try to follow some relaxation activities. Maybe you can listen to music, or you can do some meditations, and even you can do some prenatal yogas can be done. And even there are some mild activities which can calm your mind. You can do that activities so that your mind is calm, the positivity will be more, and then chances of pregnancy also will be good. Again, coming to diet, what diet has to be taken during pregnancy? First, I will tell you that first avoid spicy food, oily food, junk food or processed food. All that should be avoided during the after the embryo transfer, because any kind of these foods can again increase your heartburn and increase your stomach upset, and in turn lead to any other medications, a health illness, all that it might cause. But again, what you should take? So you should take every day at least a bowl of fruits, vegetables, all that should be taken. At least fruits like apple, pomegranate, avocado, pomegranate juice, all that has to be taken. And again, vegetable also, you can include like broccoli can be included, your spinach can be taken every day, sweet potato, carrot, all that is very good because these contain lot of vitamins, minerals and antioxidants that will enhance your fertility chances. Again, you have to avoid alcohol during this. Again, studies have proved that intake of alcohol reduce the chances of implantation, so that should be avoided. Again, hydration is very important role for healthy pregnancy and helping embryo transfer as well, because hydration, at least you have to take 3 to 4 liters of water, and at least or otherwise 10 to 12 glasses of water at least you should drink, because it help in optimizing your body's natural process that help you in conceiving as well. And again, coming to sleep, so how I should sleep post embryo transfer? See, there is no mandatory sleeping position as such, but sleeping on the tummy should be avoided. Either sleeping on the back can be done, or sleeping on the sideways also fine. And again, sleeping 8 hours a day, it's good for your general health as well. And again, even some patients want to know whether they can roll over. Yeah, you should. In case you want to turn to one side, you need not come to the center and then turning down. It's not recommended. As usual, you can sleep. That will not be an issue. Again, some patients have asked me whether they can bath every day during a post-embryo transfer. Yeah, bathing also, everyday bathing is good. Even quick shower will be better, but avoid like hot sauna bath or any kind of tub bath, swim bath, beach bath, all that can be avoided. Other than you can have a normal bathing every day. And coming to other important aspect is of the embryo transfer is your medications. Medication plays a very vital role in enhancing your successful result. So after you discharge from the hospital, your doctor would have been given all medications like estrogens, your progesterones in form of tablets, injections, everything would have been given. Some patients we prescribe ecosprin, or some patients we be giving enoxaparin injections depending on their clinical condition. Whatever your doctor has prescribed, stick on to the medication without fail. That will helpful for enhancing your pregnancy results. And apart from that, you have to take your folic acid supplements, and we do recommend vitamin C supplements, 500 mg every day. That will also improve your fertility chances. And apart from this, take vitamin E supplement that will also improve your endometrial receptivity, improves the blood flow. That will also help you in for a successful pregnancy. And even vitamin D supplements to be taken post embryo transfer, that also will help you in improving your fertility. Apart from that, I'll tell you this, apart from medications, staying positive. Again, I am highlighting staying positive is very important, because any kind of stress hormones, what happens is naturally decreases your estrogen and progesterone levels in your body level. So that will reduce your chances of successful pregnancy, and the implantation capacity will be reduced. So always stay positive during this embryo transfer. I know it's a very emotionally challenging time, but this one has to be followed. Apart from this, I will tell you that resist yourself from taking early pregnancy test, because some people tend to take early pregnancy test before the scheduled time. That should not be done, because that will be very misleading, because the same hormone we give for the support as well as for the ovulation, same hormone we are checking for the pregnancy test as well. So don't be over anxious. So follow all this procedure. So if you follow all these advices, whatever we are told, it help you in having a better outcome of this embryo transfer results. Thank you.